Hello, and thank you for clicking on my video. Today I wanted to discuss dysautonomia with you guys, talk about exactly what it is, what the symptoms look like, and hopefully answer some of your questions since you are here wondering about dysautonomia. First of all, dysautonomia is an umbrella term that is used to describe several different medical conditions that cause a malfunction in the autonomic nervous system. It generally involves failure of the autonomic nervous system or the parasympathetic nervous system, but it also can include other diseases that cause an overreactive autonomic nervous system. To put more simply, there's a dysfunction of all those non-voluntary bodily functions that our nerves would typically regulate. These are things that include like your pupil dilation, your breathing, your kidney function, your temperature control, your heart rate. So think about all the different things that we don't have to think about on a daily basis. Your autonomic nervous system should be controlling those things. But in someone with dysautonomia, and there's various different forms, they have trouble regulating those things. This can cause a realm of symptoms, including lightheadedness, fainting, unstable blood pressure, abnormal heart rates, tachycardia, among other things. So dysautonomia also can occur as a secondary medical condition, so due to something else, like diabetes, for example, or Parkinson's, celiac disease, rheumatoid arthritis, just to name a few of those. Um, and a lot of people have never even heard of dysautonomia until it's incumbent upon them to research it because of whatever they're going through, or maybe someone else. Even though it's not often talked about or circulated, it's actually not a rare condition. It's estimated that around 70 million people worldwide suffer from some form of dysautonomia. In my case, I suffer from something called POTS, which stands for postural orthostatic tachycardia syndrome. And on my channel, I plan to talk a lot about POTS and the treatment of it, and what I go through, what I experience, and how I've been able to help my symptoms. I also wanted to talk about the fact that despite that there is a high prevalence of dysautonomia, it can take years to be diagnosed due to lack of awareness amongst the public, but not only the public, also the medical community. A lot of times patients, they don't have a direction from their physician, about which way to go. The physicians are a lot of times kind of, not to say clueless, but they really don't know what's going on with the patient. The patient comes in complaining of, their heart racing, and they don't feel right. There's all these different symptoms, and so because the doctor doesn't see right away a physiological answer for this, they're told a lot of times, and including my case, that it's just anxiety that you're suffering from, or a panic disorder. So a lot of times these patients with dysautonomia are referred out to a psychologist or some other mental health professional to be evaluated. And so this person would then try to treat the patient with different things: cognitive behavioral therapy, talk therapy, various different modalities. But in truth, it can take, several months to years before this medical professional realizes that this is beyond the realm of mental health, and that there is in fact something physiologically wrong with this person. And so once they come to that realization, especially after treatment isn't working, the patient would be then referred out to different specialists, cardiologists, you name it, all over the map. They'll be referred out. And so then, the cycle continues of trying to get a diagnosis. As far as treatment or a cure for dysautonomia, there is currently no cure for dysautonomia, but there is hope. A lot of times, let's say, for example, if you have a secondary form of dysautonomia. In other words, you have, let's say, diabetes, which has caused you to have dysautonomia. If you have diabetes that is just completely not in control and you're not taking care of yourself that way, then your symptoms from your dysautonomia are going to be a lot more prevalent and intense versus someone whose diabetes is really well controlled. They can kind of get a handle on some of the symptoms that they experience from dysautonomia, which is a good thing. There's also, some treatments that are available to improve quality of life, both medications and lifestyle changes or adaptations. But even using all these treatments available, a lot of people do still find that their symptoms are significantly debilitating in everyday life. That's one of the reasons why I'm here, just to bring awareness to dysautonomia, and in particular POTS, something that I suffer from, like I mentioned. But there is hope, so that's why I'm here. I plan on talking about dysautonomia and POTS on my channel a lot, and just providing, any knowledge that I've gained from research or from doctors, and just share my experiences, share my story in the hopes of helping someone else on their diagnostic journey. So that's it for this video. I really appreciate you clicking on my video and watching this. Please give me a thumbs up if you enjoyed this content, and if you want to see more from me. Please subscribe also, that would really appreciate it. And please leave me a comment down below telling me what brought you to my video. Tell me a little bit about your story and what's going on with you. And also you can leave me suggestions of videos to make, and I just really appreciate the support. So I hope you're well wherever you are, and thank you so much for watching. Hope you have a good day. Bye-bye.